Hi, Jeremy.
Hi.
Welcome to the office today. What's been going on?
I've been having foot issues. My foot's been bothering me.
Been bothering you?
Yeah.
Okay. And how long has that been going on?
For about a week now. I've had plantar fasciitis in the past, so I'm thinking that might be what it is. But
Okay. And have you ever gotten traditional medical treatment for that?
no.
Okay. So, Jeremy, today's session is a naturopathic healing session. And basically, what that means is we're not going to be using the more traditional medical treatments to address the foot issues you've been having. We're going to be really working on the body to bring out that natural healing process that we all have, okay?
Okay.
And to do that, I'm just going to ask you a few questions about your overall wellness and health.
Okay.
How has your sleep been?
It's been okay.
Okay. And would you say less than normal, same as normal, or more than normal?
Maybe a little less.
Less than normal. And have you been going to bed any later than usual or getting up earlier? Where is this the lack of sleep?
Maybe going to bed a little bit later.
Okay. So you're having any trouble falling asleep or you're just not going to bed?
No, just not going to bed.
All right. And have you been waking up during the night at all?
Not more than usual, no.
Okay. So just not feeling that relaxation and tiredness, you need to go to bed at the right hour. All right. Is the pain in the foot interrupting your sleep cycle at all?
Not really, no.
Okay. So when resting, it feels okay. Talk to me about your diet. Has anything changed in your diet of late?
No.
And what about your stress levels? On a scale from 1 to 10, 1 being no stress, free as a bird, 10 being ready to pull your hair out, where would you say you're falling right now?
Right now, probably a 1.
A 1, okay. And what about in general?
Maybe a 3.
Okay, so stress levels aren't too high. I want to go ahead and take your pulses. So if you could just put out your arm for me. I'm just going to take them one at a time. Okay. Pulses are a little deep on that left side. Easier to feel on the right side here. Take the ones right here now. Again, a little bit deep there. Okay, take the one right here. Okay, and I just want to feel this one in your abdomen right here. Okay. What side is the foot bothering you on, Jeremy?
The right side.
Okay. Okay, next let's feel for some temperatures. So I'm just going to be sensing the entire body here really quickly. Definitely some more heat in the body than in the face. Extremities are quite cool. Is that normal for you?
Yeah, I think so.
So what that's showing us is there's a little bit of a energy circulation problem here. Okay. Just Just relax for me. I'm going to just come around and feel on your back, if you don't mind just turning a little bit for me. Thank you. All right. I am going to feel everything on the lower body as well, but before I do that, I'll have just open and say ah for me. Okay, can you stick your tongue out? Okay. All right, so Jeremy, what I'm seeing on the top half of the body here is that you're experiencing a little bit of a circulation issue. There's excessive heat in the chest and the back and not enough in the extremities. And when we're not getting our energy to circulate consistently, that can lead to those reoccurring injuries or the plantar fasciitis. The body is not keeping warm and able to stretch, and those muscles get tight and cramped. So I do want to take a look at those feet and the lower half of your body, take the pulses and the temperature as well down there before we start the treatment.
Okay.
So I'll have you lay out here, please. Jeremy, I'm going to feel the pulses down here. Is it okay if I move these up?
Mm-hmm.
First behind your legs. Left stronger than the right. Okay, rolling these down, I'm just feeling for temperature. So we have a lot of warmth in these calf area, and then gets progressively cooler as we make our way down. I can even just see by the coloring, much cooler to the touch. Definitely less blood flow and circulation down here. You said it's this right foot?
Mm-hmm.
Okay. Any pain in the left foot?
There's a little bit of tenderness.
A little tenderness.
Sore.
Okay. Just going to take a look, make sure there's nothing glaringly obvious before we start the treatment. And no known injuries, no impacts or anything like that, right?
No.
Okay. Don't see any bruises or cuts or anything like that. Take a look at the swelling. You're just going to feel a little bit of a squeezing tool. Let me know if it's too intense. Definitely much more swollen. On this right side. Just feeling gently with my hands. pain with my pressure here?
No.
I want to check the reflexes in the feet. You can just relax for me, please. And bend that knee for me. Just relax it there. Okay, not very brisk there. Try this side. Again, fully relax for me. That side's better. Give me the weight. And you're going to feel a little bit of a scraping. It's going to be uncomfortable. Good. Okay. Everything's normal there. A little less reactive just in this right ankle. I'm just going to feel for, again, just relax. Feeling for the movement in the foot. Okay. Quite a bit of rigidity. And again, that lack of energy that's circulating down here causing this coolness, the lack of blood flow, that is going to tighten up those muscles. That's why we do warm-up stretching and workouts before we really push them. We want to bring that blood and start working. This is just a more precise temperature variation tool. You're going to feel 2 little cold prongs, okay, Jeremy?
Okay.
And we are seeing a decrease in the temperature even as we descend down the foot. So the top of the foot, does that feel painful in any way?
No, not.
Is it more the middle and the heel?
Yeah, the middle of the foot mostly.
Middle of the foot, okay. And this is the more severely affected foot, so trying it on this side. Ooh, a huge drop right there. $150 down to $120. Okay. It drops even further down into the heel. Okay. The last thing I want to do before I start the treatment is just check for your own range of motion. So could you pull your foot back as far as it'll go? And forwards. And one more time back. Okay. And same thing on this side. Forwards. Back. Forwards. So that's all fine. So let me start by warming you up here a little bit. Just getting used to my touch. You're going to start feeling various tools, different degrees of pressure and sharpness. I'm going to start you out with just some warm water here. Again, just starting to get that circulation going. If anything is painful or too uncomfortable to bear, please let me know.
Okay.
Focusing predominantly on the affected foot, but you will feel me do both sides. This is a very soft brush. I'm going to start introducing these stimuli to the foot. Try and get the body to react to that. Introducing a little bit of an oil to the skin just to prevent any pain with sliding, and I'm going to start doing that pressure now as well. Pressure is going to get a little more intense as we go on. Just doing some quick motions here. What I'm feeling on this right side, Jeremy, is that tightness of the tendon here, versus the left side just feels a little bit like muscle tension. You might be compensating a little bit on this left side for the right side if you're trying to stay off the right side. Just going to do a little bit of regular massage work. Try and move some of those toxins out that we've just addressed with the point therapy. Move it up the lymphatic system to be moved out as waste. Feel that heat moving into your foot now? Let's do a little bit of scraping on that foot. Just on this side. Gonna feel a cool edge here. Should be nice and soft. I can feel the little tiny pops there. I don't know if you can feel that. So those are all just leftover scar tissue, things that need to be broken up and moved out here. Could be stopping your circulation, could be adding to that swelling and tightness of this area. I want to do our absolute sharpest tool here. It is going to feel quite sharp. But the goal is to leave the body with that feeling of needing to heal the area. Don't want to do too much because I know that you're in pain, but let's retest that temperature. Much less variation. Perfect. Just a little bit on this side. Just do a little bit of that sharpest point here. Okay. We'll just finish off with a little bit of cooling jade. We do want to bring warmth into the feet area, but we don't want to overheat it or cause any imbalance in the temperature. So when we do a lot of work, we also have to cool it down a little bit. How's everything feeling now?
Feels good.
Okay. Just wipe off some of that oil. Jeremy, I want you to lay here for about 10 minutes. And then when you get up, I want you to go drink 2 big glasses of water, room temperature, okay?
Okay.
So I expect you will feel some immediate relief from today's session. However, you do need to keep pressing the pressure points, stretching that area for it to loosen up, and just maintaining that circulation. So avoid cold foods, and just stick to room temperature water, and don't forget to stretch and get the feet moving. So doing some leg circles in the morning and the evenings, some squats if you can with the foot, all that will help that circulation keep moving, keep getting blood to this area, and keeping it warm instead of cool and taut. Okay?
Okay.
All right, well, I hope you feel better soon, and I will see you at your next session.
Thank you so much.
Thank you.